Since our last chat, there have been a few questions that have come in through our website and Facebook page. Although we've answered these questions directly, we thought it would be helpful to answer them again in this forum, as if one person had the questions, it's very likely that others have the same questions. First question. It appears that Glendale Heights has been hit harder with the virus than surrounding villages such as Bloomingdale, Wheaton, and Glen Ellen. Are there any clusters in Glendale Heights, or are there demographics at play that aren't apparent in the numbers? The village of Glendale Heights receives information regarding how the pandemic is affecting our residents from the DuPage County Health Department and the Illinois Department of Public Health. We have been in contact with the epidemiologists at the DuPage County Health Department several times in an attempt to determine answers. We have compared the statistics available from the health department and our latest census. The majority of the residents afflicted by the virus in Glendale Heights are between the ages of 20 and 60, ages that typically make up the majority of the workforce. The health department has also indicated that the case rate among Hispanics in DuPage County is 2.8 times higher than non-Hispanics. Per the Census Bureau, Glendale Heights' Hispanic population is 31%. This could account for the increased rate of infection in Glendale Heights as compared to the surrounding communities. When comparing to communities with similar populations, such as Addison, Bensonville, and West Chicago, we have observed the same higher rate of infection. We are working with the Hispanic community and the health department to get the word out to this portion of our population. Question number 2 was how many Glendale Heights residents were tested? According to the Illinois Department of Public Health, as of April 27th, 560 people have been tested in Glendale Heights. Question number 3, how many COVID-19 deaths in Glendale Heights? DuPage County Health Department does not release the number of deaths at a community level. We have asked for this information several times, even as recently as April 27th. The health department cites privacy issues as because the death rate is so low per community, it could potentially reveal how a person died, thereby infringing on HIPAA protections. In DuPage County, there have been 135 deaths. Approximately 70% of those have occurred in long-term senior care facilities. Question number 4, how are our senior citizen facilities in Glendale Heights affected? Debbie McKenzie and the Senior Center staff check in regularly on the 2 senior apartment buildings that we have in town. As of April 24th, there were still no COVID-19 cases among the residents. The staff continues to reach out to the residents in the buildings as well as management of those buildings to assess needs of the residents and have delivered food to a number of the residents who have been unable to get out. We will continue to be diligent with this vulnerable population. Question number 5, our hospital, how many COVID-19 cases are there and how many are on ventilators? Hospitals are divided by region in the state of Illinois. Our region, number 8, as of April 27th, had 102 intensive care unit beds available out of 500 beds total, and 218 available ventilators out of 311 total. On April 23rd, Glen Oaks Hospital housed 37 COVID patients and had plenty of beds available. These numbers obviously change daily. Question number 6. How many businesses are there in Glendale Heights? There are 554 businesses in Glendale Heights. The Fireside chat that we produced last Friday pertaining to the Paycheck Protection Program was sent via email to our businesses to provide them information ahead of the round of new funding that was just approved by the federal government in hopes that more of them would be able to take advantage of the program. Question number 7. What are the face covering requirements according to the governor's executive order, which is effective May 1st? The best way to summarize the requirement is to just read the section of the order that pertains to the face coverings. Public health requirements for individuals leaving home and for businesses wearing a face covering in public places or when working. Any individual who is over age 2 and able to medically tolerate a face covering, a mask or cloth face covering, shall be required to cover their nose and mouth with a face covering when in a public place and unable to maintain a 6-foot social distance. Face coverings are required in public indoor spaces such as stores. Question number 8. In light of the recent court ruling finding the governor's executive order unconstitutional, do we have to follow the orders? The court ruling in Clay County only applies to the state representative who filed the lawsuit and will be appealed by the governor. So yes, all residents are encouraged to follow the executive orders issued by the governor. This is not only in keeping with the rule of law, but is the best practice to control this pandemic and protect those particularly vulnerable from not only contracting this virus, but may not survive once they catch it. Anyone can have an underlying condition that makes it harder for them to fight the virus. It is not just the elderly. Individuals in their 30s may have underlying conditions, diagnosed or undiagnosed, that contribute to severe complications to COVID-19. And it is well documented that individuals could carry the virus without even knowing. It is imperative that residents stay at home when they can, wear a face covering if they need to be in public, keep their social distancing, and wash their hands often. We will get through this, but we need to do it by working together and perhaps sacrificing a little for a little while, just as generations before us had to conquer adversity. Stay safe and keep the questions coming.